I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. We've made many videos about prolactin, but I wanted to discuss two important scenarios where prolactin was elevated for two different reasons and the treatment approach was also different for these two patients. But what is prolactin? GnRH is a very important hormone which is pulsatilely released. So it pulsates, it has a frequency, it has amplitude, and the duration also pulsates. And because GnRH is released in a pulsatile fashion, FSH, LH and testosterone are also released because of this pulsatile nature of GnRH hormone, which is gonadotropin releasing hormone. Now, when all these hormones are released, FSH, LH, testosterone, spermatogenesis occurs. And if there is any problem in this machinery mechanism, then spermatogenesis is also compromised. What prolactin does is it inhibits the pulsatile release of GnRH, due to which FSH, LH and testosterone are also compromised. That release, when is compromised, spermatogenesis may also be compromised. Prolactin can be measured in your blood. Whether it is for women or men, it's a blood test. And when it is elevated, then medications can begin. The elevation or the cutoff value can definitely vary from lab to lab, but anything between 4.8 to 23.3 nanograms per milliliter is considered normal. But of course, like I said, it depends on the laboratory as well. They will give you a reference value. So anything that is elevated from the normal is not good and medications will be prescribed. Cabergoline is usually the medication that is prescribed for patients with elevated prolactin. It is usually given once or twice a week for about 4 weeks. However, it depends on the kind of elevated values of prolactin. If it is extremely elevated, then an MRI of the brain, a magnetic resonance imaging of the brain, is also recommended to rule out whether there is any tumor in your brain, and then that treatment totally differs. So it's very critical that prolactin be evaluated and assessed. So let's talk about two important cases. There was a case where a couple presented and the male had elevated levels of prolactin of about 28 and the couple was able to have regular intercourse. The wife was ovulating. They were not able to conceive because the sperm values were low. It was oligoasthenoteratozoospermia, which was mild, not very elevated. There was another couple that presented the male had elevated levels of prolactin of about 900. They were not able to conceive. They were not able to have intercourse as well, and the sperm level was extremely low. So we classified it according to World Health Organization as very severe oligoasthenoteratozoospermia. So when presented to the urologist, both the cases will be treated differently. The first case is where just a mild deviation of the prolactin will be put on cabergoline and treatment will be, after a week or so, prolactin examination will be performed again, and if it has come down, the normal spermatogenesis will soon be expected. However, in the second case, because the prolactin levels are elevated, an MRI was performed and there was a prolactinoma, as in there was a tumor in the brain, which was then operated upon for this patient, and prolactin levels automatically came down, and over a period of a couple of months, the patient was able to show improvement in spermatogenesis as well. So it depends on what level of prolactin is seen as elevated. Is it too elevated or is it mildly elevated? And that's what is very important in giving the treatment. If you wish to know more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.